Welcome to Rural Health Answers, a segment of our podcast, Rural Health Today, for you, our listeners, to ask questions only rural health experts can answer. In the studio today with Dr. Greg Johnson, Regional Market President at Parkview Health, located in Fort Wayne, Indiana, with campuses throughout the state of Indiana and Ohio. Today, we're going to talk to him a little bit about one question, and that question is, what management and leadership skills do you feel are most important for a rural health leader today?
So I would say probably the most important thing would be to make sure that your existing leaders are developing new leaders. And, if there is a difference between rural health and urban health, I don't know if that's even a word,
Sure.
Is that there's a lot more people.
Yeah.
Right. So it's even more.
Bench strength's a little bit better.
Yeah.
Right?
So I wouldn't say it is better. It's deeper.
Deeper. There we go. I like that.
And I would say that we need to spend more time developing our leaders.
Yeah.
And we often think physicians are leaders. And not always. They're content experts. They're professionals.
Sure.
It's incredible what we can do as a profession.
Yeah.
But we need to develop, even within our own physicians, those physician leaders, because leadership skills is different than taking care of someone, putting together a care plan, helping a patient execute a care plan.
Mm-hmm.
So I would say developing leaders is one of the most important.
So Dr. Johnson, when you say developing the leader, I would think that goes across all levels of hospital, right? Not just talking about the rural hospital, but also the urban hospital. Develop. How does one best develop a leader? So if someone's listening today saying, where do I start? Is it a program? Is it a conversation? Is it an algorithm? What is it?
So the first is intentionality. The second is people see what you do more than what you say.
Yeah.
So intentionality, and people will follow leaders, generally speaking, naturally. What I would say in the rural health setting is often you get a leader who is exceptionally strong, and they'll be there for 10 years, 20 years, 30 years, right? and then there's a void.
There is.
And so that's what I mean about that intentionality of developing leaders. And there's different, not all leaders are created equal.
Mm-hmm.
We all have different strengths and weaknesses. The key is to lean on the strengths and shore up the opportunities or the weaknesses, and helping somebody with that, because most of the times our opportunities, and I don't like use the term weaknesses because they are just opportunities. Most of the time, it's related to a lack of self-awareness. Mm-hmm. And that's what really mentorship is. Mm-hmm. It's to help somebody see the blind spot that they have. And as our pastor said this last week, is if he was talking about blind spots, and if you say, well, I know people who got a lot of blind spots, I don't have any. There's a first blind spot to work on.
You heard it here from the industry expert, Dr. Greg Johnson, and I truly say that with all sincerity. He's done a phenomenal job as a regional market president, but before that, provider, still physician, but now transitioning into really leading a very big system and charting new territories and new pathways that help rural hospitals just like Hillsdale. So thanks for joining us today. It's been great to have you.
Thank you.
And thank you to our listeners for tuning in to this segment of Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health every Monday, wherever you get your podcast. Don't forget to check out the latest updates and resources from Rural Health Today at ruralhealthtoday.com. And make sure you've subscribed to the show so that you never miss an episode. Until next time, remember the power of rural.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.